By 2050, 1 in 4 people in the UK will be over 65. The ageing population is already a challenge to the National Health Service and social care services, both under pressure to cut costs. This film examines the reality behind the headlines that surround the health and well-being of the most vulnerable group in society.
Something like 60% of admissions to hospital are in people over 65, about 2/3 of the bed days are in people over 65, and we know from the research that some of those admissions are preventable. And they could be prevented by managing people better who have long-term medical conditions, so they stay well and don't deteriorate. They could also be prevented sometimes when people do become ill by responding more quickly to their concerns and maintaining them at home. And we're not going to solve the problems of the NHS unless we do start delivering more care closer to home as the population ages.
So how do we define an unnecessary hospital admission for an older person, whether they live in their own home or a residential home?
In the immediate situation, that's an older person who has an illness which, from the medical point of view, could probably be dealt with quite adequately in, for example, a domestic setting with community health resources, but cannot be unless there is the adequacy of social care immediately available and the social care and the healthcare working collectively together. So that could be an immediately avoidable hospital admission.
My view is that there is a lot of emphasis on trying to keep people at home, and I think that's quite legitimate if it's based on the needs of the individual, but too often it's based in the needs of the system and the budget. So what I would say is what we want is the right service for a person at the right time in their life.
It can be difficult to identify what the right thing is because older people are a hugely diverse group.
When Mum goes into hospital, you know, like if she's had a fall and they've taken her, the surroundings really disturb her because she doesn't recognise the sounds, what's going on around, and she gets very distressed.
I'm living here on my own, but at least it's mine. I don't want to be in hospital.
I don't want him in hospital. They think I do, I don't. But when it gets serious, I have to.
Government initiatives such as the 2012 Health and Social Care Act and legislation on care and support emphasise the need for integrated working between health and social care. But ongoing research into integrated working and unnecessary hospital admissions amongst older people has so far not shown a reduction in emergency admissions. It has, however, shown up other potential benefits.
There was a reduction in planned hospital admissions and a reduction in outpatient usage. So as a result, the overall costs of hospital care for people who were receiving the integrated care were actually slightly lower.
It's not just about money, it's about better outcomes for individuals.
The things that really seem to work are where patients or people can take some control of their health so they become more empowered. For example, patient education in people with chronic obstructive pulmonary disease, which is a long-term respiratory condition, can reduce admissions by 40%. And there are very few interventions that we could put in as a health service that will be as effective as that. And we know that things like rehabilitation after somebody's had an admission can be really effective as well. So for example, in some of the heart failure research where they've seen their best results, patients have been able to access a specialist nurse, they've had education, they've learned how to look after their own condition, they know where to go, where to seek help if their condition deteriorates. So you've got a number of smaller interventions in there building up to one big one, and perhaps it's there that we'll see the biggest hits.
The jury may still be out on the best ways to reduce unnecessary hospital admissions amongst older people, but the challenge remains. Are the health and social care sectors ready and able to join forces to face up to it?